Hi, good afternoon, everybody. Thank you so much for joining us today. My name is Lily Farhang. I'm a co-director here at Human Impact Partners. One note as we begin our webinar today is that we're recording today's session and we'll be sharing it with you along with the slides as follow-up. Hopefully you're able to see my video. If you're having any issues with sound or with video, please go ahead and send a message through the Q&A or through the chat function. Just a little bit about Human Impact Partners. We're a national nonprofit organization using research, capacity building, and field building to challenge the inequities that harm the health of our communities. And we strive to bring the power of public health to campaigns and movements for a just society. And we're excited to have you join us today, where our goals will be to highlight recommendations from a 2018 consensus conference about ensuring equity in lead poisoning prevention policymaking, to stimulate discussion among advocates about how to advance the recommendations in day-to-day advocacy and policy design and implementation. We have three amazing speakers who will be sharing their unique perspectives with us today. Juliana Pino, Policy Director with the Little Village Environmental Justice Organization, Rebecca Morley, who's a consultant with the Robert Wood Johnson Foundation, and Christy Polin-Fedenik, Director of Science and Data at the Natural Resources Defense Council. Our format is going to be a little bit more open than a typical webinar. I will share a bit of background on the consensus conference, and then really I'm just going to facilitate a dialogue among the speakers about our findings and recommendations from that consensus conference. They won't be using slides. You'll actually see little video images of them in conversation. So we'll do that for about 20 minutes, and then we'll open it up to Q&A with the audience. There's over 100 of you that have logged in so far. And so we're hoping to have about 20-25 minutes of discussion. Please type your questions at any time into the Q&A function. We'll be reviewing these throughout the webinar, and we'll pose them to the speakers after our opening discussion. And as I said, the webinar today is being recorded. We'll send it to registered participants and then post it on our website and elsewhere following the webinar. So what I want to just spend, maybe another 5 minutes or so doing is sharing a little bit about this equity analysis of lead policies consensus conference that was hosted almost a year ago, which is amazing to consider. So in 2017, Rebecca, one of our speakers, and other lead policy experts who worked with the Pew Charitable Trust on this report called 10 Policies to Prevent and Respond to Childhood Lead Exposure, they realized, the authors, that they could have placed greater emphasis on ensuring equity in decision-making around lead policy. And I really, I give them credit for going through an amazing process and coming up with these really expansive policy and sort of tactical recommendations, and then also stepping back and realizing that they didn't do as good of a job as they could have when it came to ensuring equity in those proposed sort of strategies and tactics. And so they stepped back, and based on that gap and need, those report authors and the Joyce Foundation, which is based in Chicago and funds in the Midwest, reached out to Human Impact Partners to bring, with this idea of bringing stakeholders together to think through what an equity lens on a subset of prioritized lead policies might be. And so we spent about 6 to 8 months planning what some kind of gathering would be among national experts, and so that became this consensus conference in August 2018. And the discussion today comes out of that consensus conference and what we learned in that space among the stakeholders. And I'm not going to be talking very much about all the planning that went into it and what came out of it, sort of in terms like at the actual meeting, but if you are really curious about sort of learning what went down minute by minute, you can actually check out the full report, because we tried to be very transparent and detailed about the process. And so I just want to share one thing about the approach that we took in designing the meeting. We wanted to structure the conversation in a way that valued input from diverse stakeholders, both community members, government people, academics, funders, and others. really in a way that tries to equalize power among participants in that setting. And so to achieve that, we use this consensus conference approach, which is a structured, professionally facilitated meeting structure where participants kind of deliberate on information together and then produce kind of consensus agreement or findings on impacts and recommendations through open discussion. And so we wanted to bring a novel approach or a novel, way to have this conversation, because we know how hard it is to talk about lead policy across the country when so many communities are struggling. So just fast forward, our goals in that space, just to be really explicit, our goals were to understand the equity impacts of some set of policies and make recommendations. And we specifically focused on residential lead service line replacement, lead testing in water at schools and licensed child care facilities, and testing and remediation of lead-based paint hazards in housing. And the participants in the consensus conference used an equity analysis tool that we created here at Human Impact Partners along with the steering committee that helped guide the entire conference. So we created this tool for people to use in the meeting to try and look at the equity impacts. And what I want to highlight is that our definition of equity in the tool really emphasized equity as both an outcome and as a process. And so our definition of equity as an outcome is that we achieve equity when identity no longer systematically exposes people to risks or grants people privileges with regard to socioeconomic status and life outcomes, and when people who need those resources most are prioritized to receive them. And then as a process, we achieve equity when those most impacted by historic and current structural biases and injustices are leading or meaningfully engaged in efforts to prioritize issues, craft and implement solutions, develop accountability measures, and to monitor progress. So this was like a mouthful of a definition. We're well aware of that, but it was incredibly important to people in the consensus conference space to make sure that that we were trying to embody basically like this definition of equity in our analysis of these policies that really would achieve the world that we wanted. And so the results of the consensus conference were published in a proceedings document. That's the image on the left. You can get that from the Human Impact Partners website. The link is below. And then we also adapted the recommendations into a fact sheet for decision makers to better address equity in policymaking. So that brings us to today. Oh, no. Okay, well that brings us to today, where we're going to be discussing the recommendations and understanding how to advance these recommendations in practice. I'm going to stop the screen share in a moment and bring our speakers. Don't hang up yet, this just fast forwarded a little bit too far. So I'm going to stop the screen share and I'm going to bring our speakers to you now by video. So please just bear with us for a minute as we figure the technology out. So if I can make sure that all of my speakers show their video, Christy, Rebecca, Juliana, and please go ahead and unmute yourselves also. Juliana, I'm hoping that you're able to, there you are, yay. Oh, it brings me like so much joy to see the three of you on the screen, thank you. So for the speakers, for the participants, the best way for you to possibly view all of the speakers is to select gallery view. So at the top of your Zoom screen, you'll see either speaker view or gallery view as options. And you want to make sure, I mean, you don't have to do this, but I think it's more enjoyable to see all four speakers at the same time. If you select gallery view, it's going to bring you to a view where it's like Brady Bunch images on your screen. So go ahead and pick that option if you can, and then if you're having any challenges with that, again, go ahead and chat or send in your questions to, and my team who's here in the room with me today will help respond. So now that you're all here and you're all unmuted, I want to thank you for joining, and I wanted to start our conversation with a question for all three of you that I want each of you to answer. And so, you know, the first point I want to make and the first question I want to ask is that there's so much attention to lead poisoning and to this awareness of how race, of how income, of how place contribute to increasing the risk of exposure. It's like people know it's that the people who are most impacted are poor folks, are Black and brown folks, are people living, you know, in some of our older housing stock. And so when it's so obviously an equity issue, how is it that when we're designing policy that we're actually missing the equity piece? How is it that we're actually not meeting the needs of the people that need it most? There's so much like incongruity in that reality. And so I'm wondering if each of you can explain why you think that is, and maybe share an example or a story of what you mean. And I'm gonna go ahead and start with Juliana, and then we'll go with Rebecca and Christy, if that's okay.
Thank you. Hi, everybody. Can you hear me okay?
Yeah.
Fantastic. So in short, I think there are a few things going on that explain why the equity piece is often missed when we're dealing with lead prevention policies. I think the first thing is that folks in the policymaking space appreciate and approach the issue often with good intentions, but are often approaching it from a position of power, from a position of an outsider to communities that are most impacted, and from a position of technocracy. So they have a lot of technical knowledge that they're attempting to apply to a problem, a complex problem that from their understanding, and to solve it. Now, lead equity issues, much like any other inequity, is really, really entangled with structural inequality. And those problems can't be sort of technically solved without addressing the lived experiences and incorporating in a meaningful way the expertise of community members who actually are in the best position to diagnose the extent of a problem, that the true depth and complexity of the problem, and to also provide many of the key components to a solution. But the way policymaking is set up in the traditional sense is to really facilitate those technocratic experts to come in from the outside and to try and solve something without really having a deep understanding of what is the full range of meaning and consequence when we're talking about equity. And in lead policy, that presents itself in a lot of ways, you know, and I'll talk about this a little bit later, but one of the main ways that we see is they're not thinking about the relationship between communities and governmental authority. What kind of distrust already exists? Perhaps they have what they think might be the perfect solution, but if the community doesn't trust the local agency that might be tasked with deploying that solution, it's actually ineffective and isn't going to solve the problem. So we've seen that a lot with mistrust of health services, intersections with immigration. There are not considerations for the specific groups that might be aiming to be served and what their concerns are and their experience has been thus far. And we've had to really push to get that addressed because that problem from the expertise side, the traditional expertise side, isn't part of what they're trying to solve. So unless you're solving for the actual set of problems that the community is identifying and incorporating the expertise and concerns of the community in a really meaningful, thorough way from the beginning, you will not be actually implementing something as equitably or reaching equity as an outcome or a process, even if you set out to do that.
Mm-hmm.
Thanks, Juliana.
So I agree 100% with what Juliana had to say on this. And I think, you know, I've been in the position of being in a national organization that's working on technical issues. I also was trained in policy school. And I have to say, in policy school, they don't teach you about equity, or at least they didn't when I was coming up through policy school. And they didn't teach me about community engaged process. And so I think, you know, there's a couple things going on. One is people don't have the training and maybe even the language to fully understand what equity means. They might confuse it with disparities. This has another challenge, which if you're focused on disparities, you're focused on kind of closing these health gaps, but you're not thinking about the underlying issues. You're not thinking about the structural issues that Juliana referred to. You're not thinking about power building as a part of the process. You're not thinking about resident voice necessarily as enriching the process and making for better solutions. So I think people aren't well prepared to do this work, and we're just starting to get a little bit better at this, but still have a long way to go. I think that you know, the other thing is that trying to figure out how to engage with community is challenging for national groups oftentimes because you're not sure who speaks for who. If you don't have a history of working in the community, that should be a red flag that you need to go about the work differently, but it's not always that way. So I think kind of sometimes we plow into a community or trying to figure out who we should work with, and we can really upset the apple cart oftentimes by picking and choosing different groups or not working with anyone. And, you know, I think in addition to it being disrespectful and not being optimal in terms of actually improving equity, you can have some pretty unfortunate unintended policy consequences, because if you're not thinking about from the community's perspective what those policies are going to do once implemented, then your solutions sure as heck are not going to be good ones. The things that come to mind, for example, are on the waterfront. You know, a lot of communities are looking at lead service line replacement and using rate increases as a way to pay for those. So will that work? I don't know. Let's ask community, how much is that increase going to be? Who's going to bear that burden? How does that burden feel to those that are going to be receiving it? On the lead paint side, we'll take displacement and affordability. If you know, there are some concerns among tenants that as you improve units or improve neighborhoods, that displacement could happen, or if their landlords find out that they have a sick child, that they could be evicted. These are all parts of the process that we need to understand and fully explore with community members as we're shaping up the policies. And oh, by the way, not the least of which is like to come up with the policy solutions at all, instead of coming in and saying, these are the policies we think you need. What policies do you think you need? And then starting from that.
Yeah. Let's see. Wait, hold on.
Oh, yeah, and it's quite nice to go last, I think, because so many great points have already been made. And, you know, I agree 100%. Unless, Lily, did you need to hop in to say something?
Well, I'm going to, can you hear me?
Yes.
You can. Okay, so we lost audio for a while. Of all days, Human Impact Partners Internet basically crapped out on us twice. And so I think what our staff here are figuring out are whether everybody can now hear us. I see that there's still 163 participants on the line. I'm not seeing anything in the chat or the Q&A. So I wonder if there's any way if we can have participants like drop in a note that they can. Oh, yay! I had audio.
We heard.
Oh my God! You guys, thank you, 163 people out there in the world, for sticking with me while I was having basically a heart attack. So I hope that wasn't too disruptive. So Christy, take it away, girl. Take it away.
Yeah, even better now to go last. I get to summarize everything, so Lily will know what great comments were already made. No, I agree 100% with Juliana and Rebecca. I think that the technocracy absolutely does get in the way. And I think that, you know, another piece of that, I think, is the fragmentation of the work that we do. And so, you know, as a scientist coming in to think about a problem about lead, I would want to try to understand what are the sources of lead, what's the relative risk associated with each of those different sources. How do I prioritize based upon, you know, what the highest risk is going to be, and then you attack that particular issue. But that's not the way that people experience lead in their communities. And so, you know, we do have, you know, lead in our paint. We have lead in our water. We have, you know, in our lead service lines. We have, you know, lead in the water that we're getting in schools. And so, really being able to have that community input into the process, even into the, you know, let's say that analytical concept and framework, I think is really essential to being able to solve the issues that are really, or help solve and support the solving of issues that communities are really facing. And so, you know, I think that as we, you know, really do try to think about whole communities and ways in which people engage with their environment, it's not really just looking under the particular lamppost that we were trained to look under. And so how do we use the millions of flashlights and candles and everything else that's burning in communities to really illustrate the problems in ways that we can bring our expertise to, but ultimately really solve the problems for folks that, you know, are facing them every day and dealing with them and living through them and trying to work through them on their own.
That's great. So I want to try and bring in some stories too. So as much as in your responses you think you can reflect on, like, where did you see something go awry and what might have happened to sort of bring it back on track, I think it can sometimes help people sort of see like the technocracy in action, or the lack of you know, the sort of how the lack of engagement kind of makes you wind up with a policy that's not nearly as optimal as it could have been. And so if you can try to think of those examples, I think it will help a lot of participants actually kind of see what we're talking about in tangible ways. And so Juliana, I want to ask you really specifically about the first recommendation that we make in the report, which is around sharing power and decision making with communities, and you queued it up quite nicely when you gave your response to the first question. But kind of how would the lead poisoning policy world be different if we took a power sharing approach? If decision makers actually realized that the people that are most impacted by these issues might have solutions to some of the crises that they're facing. And I wonder if you've seen power sharing models specifically in the lead space, and if not in the lead space, even in other spaces, like where the policy actually has been better because of that engagement and power sharing.
Can you hear me now?
Yeah.
Okay. Yes, absolutely. So I think that there are a couple of ways to approach thinking about this. One is that, I think often folks think about power sharing in terms of just strict engagement of communities. So I'm just going to start with where the sort of average process lives, which is an ideation about policy, a need starts, a scope is determined about how an organization or a group of organizations might address that need. A project begins to form from that, and a budget might be associated with that project. Then they might start to assess, okay, who are we going to work with to execute this project? Then at that point, they might consider, okay, based on the scope, we're going to work in or with or in this jurisdiction or around or adjacent to this particular space or the community. At that point, maybe they start to engage community members. Sharing power would look like beginning that interaction at the point of ideation. So you're actually involving community decision-making in, is it appropriate to set this scope? Is this scope broad enough or narrow enough? Are we bringing in the depth of engagement that we need? Who is impacted in the community, and what does the community think about who is impacted? And how can we actually engage with as many different kinds of actors in the community as possible to sort of get a sense, Rebecca, of what you were saying about how do we even know if we're talking to enough people or the right people? If you start earlier, you actually have a shot at answering that question. And so incorporating community into each of those parts means that folks need to plan further ahead, and that's hard because there's a time constraint often. And it's on the folks with more power outside of the community to try and find the balance between how do we acknowledge the time constraint and moving quickly to address a problem that for us seems really imminent, and also ask the community, is this the path that you want to go down, and is this as fast as you want to go down it? And maybe that means we miss an opportunity, and maybe that's okay. And that's really difficult. That's very, very difficult in terms of decision making. But that's really the depth of engagement that we're talking about, is if it's going to be truly power sharing, we're talking about at every step of the process. And this is, we've seen success in this, and this is speaking from Little Village Environmental Justice Organization. We do work in a lot of different areas. We've seen success in intervening on power sharing in the energy space, in the lead space, and in a number of different spaces where it's not traditionally true that organizations operate in that way. But I think when you have those interventions, the procedural equity is much better, and also the policy substantively change. And I'll give a couple of examples. Before community was deeply engaged in thinking about the very first crack in Illinois at requiring schools to even test and make plans for mitigation for lead in their drinking water, as folks may or may not be aware in the audience, there's a hole in federal lead testing requirements. Schools were basically not required to test, and schools in Illinois hadn't tested. Even though we had state laws that held schools responsible for providing safe drinking water, that law did not specifically include lead, and so there was not recourse for folks to understand what was in their drinking water in schools. And essentially, there was an assumption by some policymakers that, okay, we should start with public schools. And that should be the focus of the policy. Now, when actual community experts were engaged in the process, community members said, we should start with all primary schools, because actually in some of the communities that you're thinking about, you have small private schools that folks are enrolling their kids in, and those households are actually also still counting as low-income households who are under-resourced. And we're going to be leaving out a huge swath of whole immigrant communities if we're not addressing public schools and private schools. And also, we want to see testing at a much greater range of ages. So could we also do secondary schools? Because now there are many schools that are serving all of these different ages, all at the same building. So what does it mean if we're excluding primarily high schools, even though those high schools are seeing lots of groups of young children during the day? And that those were not considered at all in determining the policy before community experts were brought in. They also noted that there have been attempts in other spaces to mitigate health concerns, but those attempts had only been in English. And this should be a sort of 101 thing, that if you're trying to support a community that does not primarily speak English, that you should be thinking about how you actually implement that program across multiple languages. That was not part of the conversation. They then decided, okay, let's do notification in multiple languages, but what about the results of testing? What about thinking through what the communication around implementing the policy looks like? A much deeper notification was also something that changed. And there were a whole bunch of other things that changed, but those are just a couple of examples that substantively changed in the Illinois law before we pushed to get it passed, that would have made a huge set of problems real, inequities real, had they not been mitigated by community experts, and had they not been mitigated early enough in the process.
That's great, thank you. That was so helpful to hear those examples and to understand kind of this distinction between bringing people in. That power sharing is really about bringing folks in at the ideation phase, like before you've concocted any potential solution in response to the challenge. I think that's super helpful. Rebecca, I want to bring it to you. One, I think the second recommendation in the consensus report was around, and Christy spoke to this actually in her opening comment, was around overcoming the fragmentation of lead policy. You know, we've got water policy, paint policy, school childcare, it's all like totally fragmented. And so I wonder if you can talk a little bit about how advocates can actually like build a path forward out of these silos. Like, what do we actually need to do to stop creating this kind of fragmentation and to try to take a more comprehensive approach? I think if you could sort of touch on some of the funding challenges or some of the institutional challenges and sort of, and on the advocacy side, how they might be able to push for things differently, that would be really great. And if you've seen models of it happen anywhere, that would be really great. Let me unmute you.
Thanks.
Oh, good.
It's a great question, and it comes up a lot among community members because, and sometimes I think about this, you don't wake up and say to yourself, I'm going to call 10 different agencies on 10 different sources of lead today to protect my child. Basically, what you want is to have your child protected or your family protected, and you also have an expectation that that protection is in place. So the first thing is like, oh, wow, I'm not protected. And the second thing is, who do I call? And then you realize what a mess of kind of regulations are out there, and they're really structural in the sense that they're in law for the most part. So we have federal laws, state laws, and local laws that are split by domain: water, paint, soil, dust, air, consumer products, food. Navigating that is a headache for an expert, let alone a consumer parent who's pretty busy and may not have all the context to kind of navigate this by themselves. So I think it's really on the agencies first and foremost to figure out how to make it more holistic and more uniform and more accessible to the parent, to the family, to the consumer. So every agency that's in this business should be thinking about, how do I make this seamless to the outside world? Because this is the kind of fragmented world we're living in. And without going up to federal legislation and to state law to try and undo all of that, I think we kind of are working in what we're working in, and how do we navigate that better is the first thing. The second thing is, don't make it worse. So let's not kind of continue to proliferate new laws and regulations that are single source. When we're starting to take on new policies, let's think about how to be more holistic, or to at least have more touch points to the other policies so that it feels more seamless. And then I think in terms of innovations for the future, a lot of what we're looking at is how do you pay for this stuff? So whenever we're talking about financing, let's make sure that the financing solutions are as holistic as possible. So one that comes to mind is the Children's Health Insurance Program, CHIP. Several states are now tapping the public health initiative component of that to cover multiple sources. So they're in Michigan, they're covering paint and water. And I think we're just beginning to have a conversation about new funding mechanisms at the local level. So what would it look like if many funders came together and had a pooled fund that could be used for all sources? And then you would have many different sources of revenue coming into that. It could be bond money, it could be healthcare dollars, it could be school money that they would be spending on special education anyway, so why not put them into the prevention? It could be housing dollars. Let's flow those into one pool so that they can be used flexibly so that people don't have to navigate the fragmented system.
Great. And I should say, Christy and Juliana, if you guys, or all three of you, like want to pop in and ask a clarifying question, like you should feel free. Yes, I'm facilitating, but I don't feel ownership over it. So if you have a question that popped up for you, go ahead and ask that of the other speaker. So Christy, if you want to come off mute, I think what I want to talk to you a little bit about is that you are in one of the more like kind of mainstream environmental advocacy organizations that I think is it's building its equity road and sort of doing better and better on equity like as time goes by. And so I wonder, like NRDC, some of these other organizations, they might think that any intervention around lead is necessarily about equity, right? That of course. And I wonder if you can talk about why that might not be the case, what the consequences of that sort of misunderstanding have been, and how at NRDC you all are approaching these discussions differently, as a result of some of our learnings at the Consensus Conference and some of your own learnings, obviously, as experts.
Yeah, I think that's a great question. Thanks for that, Lily. I mean, in a lot of ways, I think it does come back to, what Rebecca was talking about in terms of fragmentation and what Juliana was talking about power sharing. And so, in organizations like NRDC and others, I think that there's also a history that has to be overcome, right? So, really thinking about being the expert in the room, believing yourself to have all of the solutions to all of the problems, and really just having that internal knowledge that you channel in order to affect policies or to change or create policies, I think, can be a hindrance to that advancement, right? And so one of the barriers, I think, in terms of big greens or, other large organizations from, really advancing equity is understanding first what equity means, not necessarily just from a philosophical and technical way. Again, I think that we're going to gravitate towards what's the definition of equity? How do I check the box and understand that I'm doing those things? What's the method that I follow in order to achieve equity? And I think that it's a bit dirtier of a process, and in ways I think that having again that community lens, that community driven, that community focused way of understanding equity and what implementing various policies are, how we should think about the work that we're doing in ways that are really supportive rather than the complete driving force, I think is something that we really want to try to take into account as we move forward in this space. And when I think about concrete examples, I mean, I think drinking water and certainly in other spaces as well. I've had some work that was occurring prior to the Consensus Conference beginning, and one of the questions in the Zoom chat I saw was, do we incorporate community members into the research process? And so, I was doing an analysis and assessment that, again, just was based upon data. So I would just go into the database, I'd pull the data out, I would, come up with what I thought would be the finding associated with that. And so it wasn't at the ideation phase, right? I'm just kind of going through and seeing what I see. But really, even just doing that preliminary, having those preliminary findings and then taking those to community members and allowing community members to shape what the narrative is even about those data. Should I change the way and the structure in which I did that analysis? So having a starting point to say, these are some of the issues we're thinking about. We know that there are groups that are interested in that. So in a lot of ways, that is missing an opportunity for power sharing, I think. So it's not someone coming in and saying, these are what our problems are. It really was us defining what it was that we were looking at. But I think that, at least to me, this is something that would be different now after having gone through the Consensus conference, and then also a lot of the equity work that we're doing, that community members really did come in and help us understand how to tell the story in ways that might have been outside of what NRDC would have done in the past. And so I think that, you know, really trying to understand, bring in community perspectives, understand what equity means, not only from our perspective, but from others, incorporating that into our processes, I think is, you know, going to be a long road, but something that I think that, you know, we're working on trying to do and encouraging others to do as well. So.
That's great. So let me, I have a couple closing questions I want to ask you, but I actually think it would be helpful to kind of share with you a couple of the questions that have come in from participants, actually. So there's one clarifying question. Rebecca, you know, I posed it as reducing fragmentation, and someone asked, like, do you actually mean a county agency shouldn't create specific regulation around lead? Like, is that, like, what would be a different way of approaching that issue if they want to reduce fragmentation?
So good question. So for example, say a county is taking into under consideration developing some sort of ordinance for lead. Let's call it a proactive rental inspection program to check for lead hazards in housing. In the old days, they would look just for probably deteriorated paint. We've gotten them to kind of expand to look at dust and soil, but they sure as heck aren't looking at lead service lines or the presence of lead in drinking water. So expanding those efforts to make sure we're capturing the majority of the sources of exposure. And again, those should be community driven. So if the community with their scientific friends have just determined that we don't have a lead in drinking water problem, okay, but let's make sure that there's been voice given to that question early in the process. And it's not, because if they're trying to add it after the fact, that's always much more difficult. People want to keep things simple, people want to keep things moving. And I think it gets back to the ideation stage that both Juliana and Christy shared, that if you approach that question very early on, you won't have something come back to bite you later on.
That's great. So in some ways, it's like we're not discouraging county agencies from wanting to act. What we're encouraging them to do is to start to think more holistically and sort of talk to community partners, but sort of think more about, okay, you're going into people's homes. How are you taking a different approach into what the experience might actually be and the information that you're collecting?
Exactly. And I actually think the more you act locally, the more often I see these comprehensive strategies coming out. So I would actually really encourage local action on this issue. And because lead is so local anyway.
Yeah, so it's interesting you say that because Victoria Kraus, I'm looking at the chat, and I know people are submitting through chat and Q&A, and that's totally fine. We've got it all covered. Either option is great. She has this comment in here, and I think all three of you can actually speak to this. Local advocates that we work with are very focused on local impact and getting lead out at the city and county level. How can we work with them towards statewide solutions? How do we get funders on board for community-driven solutions? We have to apply for grants up to 1 or 2 years in advance and list our desired outcomes. So the process is kind of backwards. I would say word up to that part. But I wonder if you can talk a little bit about this idea of knitting the city and county solutions up to statewide level change. I don't know who would want to speak to that first, so I'll let you all decide.
I can take a crack at it.
Cool.
So we have found that part of engaging and really making participation meaningful is demystifying democracy. So this is like zooming out even from the issue of lead, but yes, impacts are felt locally. And sometimes the decision-making that led to that impact is a local one, but oftentimes it's not. And part of how we've worked in Little Village and with other frontline communities in Illinois and sometimes in the region and sometimes nationally is one of the very first things is to understand how something came to be, and for communities to understand whose decision making or what policies led to something being a production in reality. And often, sometimes people understand, right? This is actually we need to fix a state law to change this, or we need to mandate that the county do something, and we can't sort of rely on the county to do it itself, or the same for the city. Or various jurisdictions that they actually like play together, and sometimes in ways that produce these unequal outcomes. And having that insight into why is reality the way that it is, what are some of the reasons, who are some of the decision makers, if that's a factor, sometimes it's not, is a really good way for folks to understand where the solutions might need to live, and to also say, I see myself as part of making this change. And sometimes even after all that information is presented, communities are like, you know what, I'm good. I actually don't want to get involved in something structural, but I would like to support other people to do that. And let's bring in other communities who might be more interested in that. But it really starts with, why would we want to do something at the state level, right? That knowledge about why and how the policy structure works, and also how legal requirements work, how regulation works, is not knowledge that communities have most of the time. And so it makes sense to demystify that as much as possible, and to do that alongside community members so that they can understand, oh, there are these different points of intervention, and we actually want to intervene in multiple ways and in multiple scales. So that's, I think, the sort of number one thing, is that it's actually about democracy, and actually about people not only understanding and having the educational privilege, the access to knowledge about decision making generally, or how the government works, which is part of why that hyper-local focus emerges, is because folks are like, this is something I know, this is close to home, I could actually do something here. And that may or may not be true for these other scales, but oftentimes it is true. And folks can't sort of make that decision on behalf of communities. Communities have to get the information and make that decision themselves.
Yeah, what I hear you saying is there's like almost a level of political education that has to happen.
Oh, yeah.
And the beauty of what you're describing is that it winds up translating not just to the issue of lead, but it's like this,
Right.
it can be self-efficacy that's then leveraged around housing or economic security, or like any, transportation, whatever the issue is.
That's right.
That's great. Rebecca, were you going to add something?
Well, I agree with that. And I think there's also a practical issue, which is many of the local organizations are not funded to work on state level work. And so there's a capacity and a funding issue. And I think our advocacy infrastructure is woefully underfunded, both at the local level and especially at the state level. The idea of getting multiple nonprofit local groups to band together at the state level is great. It doesn't happen that often, and I think a lot of times it has to do with capacity and funding. So I think, that is a call for both government and philanthropy to invest in that infrastructure, not only for lead, but to build it so it sustainably is there for all sorts of public health issues and environmental health issues.
Mm-hmm. Mm-hmm.
Yeah, I would say that I agree with that too. And I think it's also about political strategy, right? So not only the education, but maybe it is getting a couple of key states to flip in order to, or change in order to influence a national policy, right? And so I think that fragmentation piece goes beyond lead as well. So we do have, the local advocates, the state advocates, the, national advocates, the world, global advocates aren't necessarily speaking to each other in ways that allow them to really try to maximize the power and the change that's happening at the local level too.
That's great. So thanks again to folks that are putting their chat and their questions. And I wonder, I'm going to just pivot and actually just focus on these rather than the ones, my prepared questions, since they're coming in. I wonder if any of you could speak to like urban rural nuances that should be kept in mind. I have no reflection on that to share, and so I wonder if any of you have anything to share on that.
Do you guys want to go?
Sure. Yes, I can share something on this. So as I noted, we are based in Little Village, but we work with communities throughout the state and sometimes throughout the region, sometimes nationally. So if we're trying to think about policies through an equity lens, we absolutely have to attend to the differences and needs of communities in these different kinds of geographies. And in Illinois, we also have regional differences. So we've got northern, central, southern Illinois, those have different cultural practices, and that means that laws are implemented differently. So we have to take a sort of social view to really understand how might these play in the real world once they're created. And communities have different needs, and that does have substantive consequences for things like, how will the funding for lead remediation actually work? If you're talking about a water system that's much smaller and is rural, the way that water system rate bases solutions or not will have very different consequences, likely in terms of like the scale of what they would need to raise from customers from a much smaller customer base. If that's a community that's also really poor, that's a huge equity problem. You know, there are also issues in terms of the infrastructure, the age of the infrastructure, the kinds of materials people are using in lead service line remediation, and what kinds of access they have. If they're a small municipality that has a very small tax base, that municipality may also experience barriers in terms of implementing regulations that larger municipalities may not want to implement, but could actually implement. And so really taking those things into account is extremely important, because it really changes the potential inequity and also the potential opportunity of implementing a rule. And I would say that that same thing is true in terms of thinking about childcare facilities, parks. You know, those look very different. The management system of those different kinds of areas you're thinking about look very different in these different regions. And so it's really important to, if you're doing something statewide or across a broader set of actors, to attend to those differences and to make sure that you're incorporating community expertise from those different regions, because also you can have, you know, communities that look very similar to the unaware do-gooder outsider, but actually in practice are very different substantively. And it matters to do the work to try and get them together. And often that can be really difficult to fund, Rebecca, as you're noting. And what we've been working on is starting to work on proposal processes and things years in advance of the work, because that sort of aligns with the funding timeline, and incorporating communities into the proposal writing process too. So even taking it a step back into the funding process, that communities and their capacity be funded equitably in proposals such that they could actually then participate in the work meaningfully. And it's not about reverse engineering communities that are not funded, that are volunteers, into a funded organization's process.
Yeah.
Do either of you guys have anything to add on this urban rural? Christy, you're shaking your head yes.
Yeah. I was going to say, you know, from a data perspective, I actually think about this quite a lot. So if you're really basing your, you know, policy suggestions and recommendations on information that's available to you, we have a data-rich, you know, environment oftentimes, you know, and more urban environments, or say, I'm coming from a drinking water perspective for, say, the larger drinking water systems. And even though there are failures there too, we at least have some information. But when you really start getting into the small drinking water systems, or wells, or people that, you know, have, you know, are migrants that have access to, you know, different water sources at different times, we really have no data on these communities at all. And so I think that there can be a tendency also to ignore, or, you know, just miss. So maybe not an active, you know, ignoring, but you just miss these communities because there isn't information available about them, or you have to try to find, you know, different resources that may or may not be easily accessible. And so I think that one of the nuances that I really think a lot about is, how do we try to account for communities for which we have no information or data, again, if we're going from a data perspective, to really ensure that those stories are being told, whether or not we have numbers to go around along with those experiences or not. And that's where, again, I think that the community voices, the community experiences, the community expertise become vital and really essential to being able to move forward with any research paradigm.
That's great.
That had me just to think about something that was horrifying during the Pew reporting, now that you mentioned data, is that we couldn't find any public health data on lead for indigenous populations. And so as a result, I think oftentimes when people do not have data, they feel like they can't make recommendations. If you're making evidence that, you know, based decisions, how do you do it without data? Well, some of it is that you can bring community voice in, and that can serve as your data, but you have to be planful and have that really be part of your process very early on. So I'll just say that, you know, in the Pew report, it's an area that is not well developed, and it was, you know, just something that all of us were grappling with. It's like, why are the data so sparse for this population? And how do we make recommendations? What would be the best way to go about that? We realized it's probably an entire project in of itself.
So one, I give props to the one person who like a week ago sent me a question by email because she wasn't sure she was going to be able to be on this webinar. And so her question was, what is the role of health plans in reducing lead poisoning effects in communities? What are they currently doing that is working? What else needs to be done? I think, Rebecca, you had like a mildly snarky answer to this.
Right. What did I say? I'm afraid to ask, and hopefully there's no plans on the call, but if there is, I guess speak truth to power. Did I say nothing?
Basically.
I don't know that that's entirely true. Like there may be, and I just don't know about it, some plans that are paying for lead remediation. as far as I know, most plans would pay for blood lead testing, but that's way too late. And so I don't know, I don't have good examples of what plans are doing on the primary prevention side. And if people have ideas and have heard of things, then my apologies to the plans for not being aware of those.
Okay. Christy or Juliana, do you have anything on health plans and what they're doing on primary prevention?
I do have something on health plans in case there are any health experts on the line. So we haven't seen addressing primary prevention in health plans in Chicago either, or in a number of different jurisdictions who will not be named, but let me just be, we're based in Chicago, so I'll just speak there. And partially that also speaks to a larger structural issue in public health where you have individual level causation be the focus of the plan's intervention, and they're actually not thinking about structural health at all, let alone specific structural health issues like lead. We deal with environmental justice broadly, so we also see that in terms of air quality exposure, green space access, a whole bunch of different things that are clearly structural, but frankly are not addressed by most plans, because most plans are thinking, well, is this person eating enough servings of vegetables? And in fact, is their individual decision-making to blame for health outcomes that are partially related to individual decisions, but are mostly caused by structural inequalities? So that's a sort of like fundamental problem that I think prevents health plans from being in a position to address comprehensively structural health issues generally. We have started to see more efforts in the public health space toward thinking about cumulative consequences of different structural health inequalities, and then thinking about like the role that city administrations and others can play earlier in how they deploy resources. But really it's very nascent, partially because this is a broader public health issue.
Yeah. I will just flag, Laura typed into the chat box, hi, I work for United Healthcare and we pay for remediation when lead levels are 5 and above. So if anybody wants to ask Laura more questions, shoot us an email and we'll figure out who Laura is and get you guys connected.
That's great. And I mean, I think that's terrific. And I would want to know, what would it take to get a plan to pay for remediation prior to an elevation? What are the barriers within the payer system that make that difficult to do? So that maybe is that might be a follow-up for Laura and for conversation. So thanks.
So we have another question that came in, and I think this is gonna be my last question that I pose to you before I kind of do our closeout question. So the question is, what do the panelists think about applying an equity lens when working with populations who are exposed to lead from non-traditional sources, i.e. not paint, not water? Our community sees lead exposure from occupational sources, cultural practices, and refugee camps.
So that's a great question. I would love to hear how you all would tackle that specifically. I'll just say it kind of reinforces the whole point that if you start with community, the solutions will be driven by the community. So we wouldn't be having a random conversation in that community about proactive rental inspection or lead service line replacement. We would be starting with those concerns that are the highest priority and likely going to give you the biggest return in terms of impact.
Yes, I would echo what Rebecca says. We would do the same thing. And this is actually really akin to how we think about it in environmental justice more broadly. In Little Village, for example, you have lead exposure through water, you have lead exposure through old housing stock, but you also have a lot of lead exposure through soil because we were the home of a former power plant and a number of other industrial activities. And so workers, as well as residents, were breathing in particulate matter and other co-pollutants from emissions, including things like lead. Also, there are lots of different kinds of points of intervention there that wouldn't be considered in the sort of space that we're talking about with drinking water, and that would come from the community. For example, we're also an agriculturally focused community, and so when community members want to plant things, for example, there's a whole other system of intervention that folks called upon around how can we make soil testing accessible? How do we support people to use raised beds instead of planting in the ground where their vegetables would be contaminated? And that came from community members saying, this is a practice we want to engage in culturally. Also, we're experiencing this at work. How can we work with labor laws and labor regulation to support mitigating our exposure there. And so if you think about it from a justice and equity standpoint, you would be starting with the questions of where the greatest impacts are felt, and then evaluating what are the different routes and decision-making processes in government agencies, and making that clear, that are actually responsible to manage that, and how can, you know, responsible, really thoughtful interventions be developed alongside communities identifying those issues.
Great. Yeah, and then the thing that brings up for me though too is, you know, if you have a community that, you know, if I again work on national scale data, then that community wouldn't show up in the analyses that I'm doing. And so that's why I think it's also really important for, again, you know, larger organizations and even smaller organizations to really try to think about these problems more holistically. And so rather than just saying, you know, the majority of exposures come from X source, how do we really think about the people that are the most impacted, what their needs are, how do we create those lines of communication, even if it's, you know, again, coming up with that non-fragmented, you know, local, state, national groups that have some way to talk to each other to really elevate these issues that folks are experiencing. So, you know, as a person that's relying largely on publicly available large national scale data sets, I wouldn't even know that that community exists. Yeah. And so I think that that's one of the issues that we really need to try to confront and grapple with, and try to identify ways in which, again, to power share and really ensure that we're solving the problems that are most important to folks on the ground.
Mm-hmm. So we have just a couple minutes left, and I want to bring us home. And you know, we were really deliberate in using this consensus conference approach to bring stakeholders with what is traditionally viewed as different degrees of power into conversation with each other. And you know, each of you works with different sectors, with impacted communities, with organizers, with government entities, you know, advocates, funders. And I just wonder, you know, sort of like, why was that setting helpful for you from the sector and your vantage point? And sort of like, what's a thing that you felt like you could do coming out of that setting differently for, you know, the work that you're doing in the lead poisoning space, lead policy space? So if you guys each just like 30 seconds, and then I'll just wind us down. Let's see, Christy, you go first.
Yeah.
Do this in the reverse. We'll go Christy first, Rebecca, and then Juliana. Oh, mute.
Oh, yeah. Sorry, I was muted. Yeah, the thing that I took most from the consensus conference was the rawness and the passion of everyone that's coming in to, you know, this discussion from the various vantage points. And so I think even though the conversation wasn't easy, I think it was a really important one to have. And the thing that I took home from it was, again, really taking the time to understand what equity means from a community perspective, and then acting, even if I need to on my own, as a source of accountability for my organization to ensure that we're not just hiding under the cloak of equity. And I think it takes more than just an individual within the organization. It takes that, you know, community, you know, just again, the broader community, not just like the people community, to really hold all of us accountable in that space. But I think that being able to be a part of that meeting, really just the visceral, you know, just responses that folks had to these issues was something that I thought was really a blessing to experience, and something that I've taken back with me to the work that I do, and just really ensuring that we're not hiding and actually trying to do this work in a meaningful and respectful way.
That's great.
I agree with Christy. It was really great to have such an honest conversation, and I liked that this was a heterogeneous group. I find that so many conversations that I'm in are either funders or government or community, and it's never everyone together. And I think by bringing everyone together, you can really start to understand each other's perspectives and come to some common strategies for working together. So that was really helpful. It did also dawn on me that strong facilitation is a must. And so I don't want to embarrass Lily, but she did a phenomenal job in her team of kind of making sure that we were all feeling supported and able to have that frank conversation. So that was amazing. I think for me, I also took away just this idea of needing to invest more in having communities to feel supported and have the resources they need to be part of these conversations. And so we recently did a round of grant making through our WJF to 9 communities, and the money and the coaching is to really do just that. So I think that was a direct action out of that, and I hope we can do a lot more of that type of thing.
That's great. Juliana?
Yes. So, as you know, as someone who is situated in a frontline community, context, I'm always going to spaces. My primary goal is to connect with others who are also situated in frontline communities and to be able to do lateral relationship building. And to, I think in this context, it's always helpful for us to participate in really cross-sector spaces, not just because those spaces are de facto hold more power, but because the outcomes of those spaces are consequential for the communities on the ground. And it was really important to, you know, incumbent on us to really highlight the ways in which humans in these communities have experienced very well-intentioned attempts at solving for narrowly focused lead drinking water-based problems, and really like the depth of the humanity that really needs to be brought to light about what are the consequences if we get it wrong. And I was also really interested in learning from the experts coming from different sectors about the kinds of pieces that are behind the veil, let's say. So, you know, we can democratize information about a lot of things, but also historically, complex nonprofit structures, funding, complex decision-making on behalf of utilities is done in closed rooms. And so that's not information that advocates get access to, or organizers. We have to really press for it, or FOIA for it, or do all sorts of things, you know, that like we could be avoided if we would just talk to each other. And in some cases, we have good working relationships and can get access to that. In other cases, it's not. It's very contentious. And especially when it comes to something like lead, where there's a, you know, high risk, that kind of sharing is not typical. And so I really valued that space. I thought it was excellent to be able to connect with other people and to really be able to be honest. And I totally agree, Rebecca, strong facilitation is a must.
That's great. Thank you all so much. We're now at our ending time. I'm not going to bring my screen share back up to show you the contact info of the speakers. We will send that around in a thank you. Please feel free to contact anyone on the webinar if you have any questions. We'd love to hear how the recommendations that we make in the report and fact sheet are kind of being used in your own communities. Thanks, Rebecca, Christy, and Juliana. You guys are fabulous. It was really nice to do it this way and not be talking over PowerPoint slides. So Rebecca, you get the credit for that suggestion. So thank you. And thanks everybody for sticking around, and have a great day.
Bye guys. Hey,
bye everyone. Thank you all.
Bye. Thanks.
Bye-bye.